Hello and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. I would like to formally bring on our guest for today, Emily Napier, who is the new business leader for Europe over maternal child care and women's health at Philips. Emily, thanks so much for being here.
Thank you so much for having me. It's a pleasure to be here.
Yeah, so excited to dive in and learn a little bit more about this yourself and just the amazing work that you're doing. So maybe with that, would love if we could just jump in and if you could kind of, with me and the audience, just share a little bit more about your personal journey, what kind of led you to where you are right now working at Philips.
Yeah, of course. Yeah, happy to do that. So I started off actually American University. I did a degree. I was on a tennis scholarship out there. And then I started my own company still in tennis and sports before going into marketing. And so I worked very much in the brand management space at Coty and Unilever before joining Philips 7 years ago. And when I started Philips, I led the oral healthcare dental team in the UK. Then I moved into business development for the UK, then for Western Europe, where I look after 18 countries. And actually, in the last year, I've focused on mother and childcare and women's health category, especially. So it's something I'm personally super passionate about. I think women's health is a fantastic area to be involved in, and hopefully, a lot of people who are listening are also in this area. So I think it's nice when your personal kind of aspirations also meet with the professional. So yeah, for me, it's been really fantastic that Philips are diving more into women's health. So to be part of a company which supports that and progresses that is fantastic. So yeah, it's that's kind of what I do today. I work a lot with direct to consumer programs, the B2B space, so working with insurance companies, governments, public health organizations, so very much in the preconception, pregnancy, postpartum, but I focus on the pregnancies and maternal health.
That is incredible. And would love if you could dive in a little bit more, kind of talking about your really interesting kind of career path. For you, how do you think your career trajectory evolved kind of from your early days? I know you mentioned marketing and your own business. What was kind of the catalyst for those kind of that career path that has led you to this current role?
Yeah, I've done a few different things. I definitely started off more in the sports space and marketing, and now more in healthcare. But I started working with kind of more of the payers, the insurance companies within our dental programs about 4 years ago now. So it's been a few years since I've been working in that space, and actually transitioning over towards maternal health has been really interesting for me. But only in the last year or so, we're probably coming into 18 months now. Yeah, and a lot of people might think, oh, insurance maybe not so interesting, but actually, I've been really loving that, looking at how they're driving digital healthcare, and that's a really big area that a lot of insurance companies are focusing on, and particularly when it comes to women's health. I think a few are still a bit unsure about what to do, how to dive into that. So being able to kind of advise and help promote programs, especially around maternal health. I think when we kind of look at pregnancy, and we'll talk a little bit more around that, but there really is a bespoke need for care in this area. And obviously, a lot of people are going through this or have family or friends going through pregnancy, right? So I think it's a great area to be able to say, how do we provide better access to care? So this was something that I wanted to get into, and kind of, took an interesting kind of route into healthcare. But now I'm in the healthcare space. I really love it, and it's something that I enjoy doing every day.
That's incredible. And I like that you mentioned some of the things that you're seeing with payers. I definitely have so many questions. I will keep in mind to ask you that too. Kind of first wanted to learn a little bit more. For you, what kind of motivates this emphasis that you have, with the pregnancy space, and kind of like you were mentioning a little bit earlier about expanding into some of these other areas like postpartum care, with the work that you're doing at Philips?
Yeah, I think for me, like the motivation really comes from like such a large percentage of the population will experience pregnancy in some way, whether that's personally or through people that right? And particularly when we look at preconception area and whatever that looks like for individuals. So a lot of the time, obviously, it's a happy experience, but it's not always the case. So I think I'm really motivated to try and, how can we get more of the happy, healthy, outcomes that everyone deserves to have. So there are a lot of like risk factors, especially during pregnancy. So postpartum, we talk postpartum depression is affecting about 17% of women globally. This is often, underreported actually, because we know a lot of cases go undiagnosed, or actually there's still so much stigma attached to people seeking help. So that's something that I think is really important to be able to talk about, to kind of remove a bit of those taboos and those stigmas. And a lot of people are still not receiving this like sufficient care that they really need to be doing. And another area that I'm super passionate about is returning to work. So, if you
Oh,
look at stats, yeah, after maternity leave, it's really interesting.
that's a big topic, 100%. That's cool that there's a dedicated kind of interest in that.
Yeah, I think so. Like in the US, like about 25% of women return to work within 10 weeks. Obviously, as you guys know, it's very short maternity leave compared to Europe anyway. After giving birth, and it's 43% within 12 weeks. In Europe, it depends on the country, but it can be anything from 3 months to even years in certain countries. But what we see is actually 98% of mums want to go back to work after having children, but actually only 13% think that is viable on a full-time basis. So we see about 20% of dropping off and not returning into the workforce. So this is like a really big issue that is impacting, particularly when you look at maternity policies. And I think it's interesting if we look at like shared parental leave, and this is something within Europe that's getting a lot of focus at the moment, and definitely is helping, because obviously if you can share that parental leave, it will support career progression, empowerment for women in the future. And I think it helps if we start like challenging these social norms of being the main caregiver, right? And how we can be more progressive in society.
I love that. That's such like a good, I think, overarching mission when it comes to just supporting women during this time. And you were kind of mentioning a little bit earlier how, with the work that you're doing in the preconception pregnancy space, everyone is kind of has their own unique disposition, kind of what they're looking for. For you, I could only imagine all of these external drivers, definitely have an impact in pregnancy care, things like, maternal age, lifestyles, etc. How, what is your take on being able to address some of those surrounding issues within the context of pregnancy care?
Yeah, so we see maternal age is increasing. So I think if you look at, 20 years ago or so, a lot of people were having their kids in their early 20s, but now the average age in Europe is 31. So maternal age are increasing. But with that can bring extra complications, and also aspects such as lifestyle, so nutrition, diet, and also sedentary lifestyle. So a lot of us now are having jobs where we're not, active. So we're very much sitting down a lot of the day, and that can also, have an impact on lifestyle in general. And when we look at fertility, 1 in 6 couples struggle to conceive. And I think 30% of pregnancies are considered high risk. So there's lots of
Wow.
yeah, a lot, and that can be anything from conditions such as gestational diabetes, preeclampsia, hypertension. So those are some of the contributing factors, and also like lack of early or access to early pregnancy care. So even in developed markets, you have about 500,000 women in Europe who don't have access to any care during the first few months of pregnancy, and 6 million in the US, women who live in maternity care desert, so they don't have any access to hospitals or healthcare professionals. So there's a lot of kind of areas where we can be definitely like looking into to improve. Maternal mortality is still really high, and that's something, in 2020, 800 women died from preventable pregnancy and childbirth causes, and this is something that shouldn't be the case, especially when it's preventable. And we see this is 3 to 4 times more likely as well for women of color. So regardless of the socioeconomic status, this is like some key areas that we really need to be addressing in this space.
Absolutely. Yeah, it's really interesting to see. I think there's so much amazing innovation that's going out there that are kind of addressing or just really supporting the space. But I liked how you kind of outlined some really key areas of opportunity that I think need not only a lot of innovation, but just general like cultural paradigm shifts. So I think that's like really, really important. And I like that you called that out. So, and Emily, can you share a little bit more? I know that Philips has like a pregnancy plus. So can you talk a little bit more about that? And really, you had mentioned this a little bit earlier about, inaccessibility to those early stage appointments. Would love if you could shed any more light on your experience and kind of what you're seeing in terms of the accessibility issue within this space.
Yeah, so I think for those that don't know, so Philips own a pregnancy app called Pregnancy Plus. It's a fantastic app. We're super lucky, actually. It's the #1 pregnancy app in the world. So it's the
Wow.
yeah. So in Europe, 80% of all pregnant mums use our app. So the app, if you haven't had a chance to go through it yourself, it's really super. It's and most of the app is a free service, and this is something that's really important for access. So we have over 1,000 different articles, and it does a week by week view. So if you go in, you put your due date in, it has the 3D model of the baby, which changes by week, so you can see how the fetus is developing. You can learn basically about the development, like what you're going through during pregnancy, how the baby is developing, And it's also lots of lifestyle articles, content. What should I eat? What should
Hmm.
I eat? Should I get a tattoo while I'm pregnant? So many questions that people might have. Is also in the app, so it's very engaging platform as well. It's not just on the scientific body, but we do have obviously some articles in there as well. But it's not a medical app, so that's not the purpose. It really is a content and engagement platform. But the idea is to work with these payers in the space of insurance or governments to really help provide the best services. So we have the free version of the app, and then we have a premium version of the app, which has more courses and content. But you can still unlock that as a free member. So we really do believe that everyone should have access to it. So by completing certain actions or tasks, you can get reward points, and then you can unlock the premium content.
Yeah.
So there's always a way to be able to do that. But digital health tools obviously can be super important. So it's more the education and the information that a lot of people are lacking, or it's not in one place. So you might be able to find it, but you have to Google and look through many articles, which one's credible, which one can I trust. So to have it all in one place where it's been completely vetted by healthcare professionals or people who have the right credentials, I think that's really important.
That's amazing. And I definitely agree. I think it's so common to have just the information overload, and you don't know what you are looking for at the right time that you're looking for it. So I love the idea of just kind of like having like relevant content kind of at relevant times of like the pregnancy timeline, and just kind of making information more consumable, which I think I'm very on board with just in general. So I think that's really
the TikTok generation, right? So we all want
yeah,
like
exactly.
bite-sized content, like short articles, videos, content. That also is like really easy to understand. Like anybody can pick it up and understand the information.
That's amazing. Yeah, it is kind of crazy how our attention spans have shortened, but it is
Yeah.
great that there's a lot of this type of content now too. That's incredible. And Emily, you had mentioned a little bit earlier, kind of talking about some of the high risk issues that you've been seeing and how these rates have been increasing. For the rise of these high risk pregnancies, for you and kind of what you're seeing, are there any unique challenges that women who kind of have these high risk pregnancies face? And is there anything that you've kind of been working on, any initiatives at Philips to kind of mediate some of those things?
Yeah, so some of the key challenges are definitely around like emotional stress and anxiety during pregnancy. So with high risk pregnancy as well, obviously there's like this does evoke a heightened emotional stress due to the concern with the health of the baby, potential complications. I think anybody dealing or coping with uncertainty, it's also like managing well-being. That can be a significant challenge in itself. And there's often complex decisions that need to be made. Talking about different healthcare options, different birthing options, looking at interventions, medical procedures, or even like choice of healthcare provider, like what benefits are offered, what are not offered, what's included. And so we know people like typically join Pregnancy Plus, so they onboard onto the app super early on, so
Oh,
about
wow.
week 6 to 10. So really, really early in the pregnancy, which is fantastic because it really gives the opportunity through digital health education to say like early on to really get that information, because with pregnancy obviously you only have 9-10 months to really make an impact. So the earlier you can get the health and the information to resources to people, then they can consume them, and then they make healthier choices, decisions, which can help. So we're looking very much in the behavioural change space. So how do we look at topics and how do we help to improve behaviours really early on? I think we're in a unique position to be able to help and influence that. So it's working with with companies to support that. So it could be we spoke a little bit about workplace challenges with employee benefit providers. So
Oh,
how
wow.
pregnancy benefits as support packages. So I think we're seeing it a little bit in the US coming through fertility pregnancy support. It's not really the norm in Europe yet at all. So it would be great, for companies to really take that initiative and to provide these benefits. So I think that could be one area.
That's so fascinating. It's cool that you kind of have that. And I definitely agree. I think, so much of it really is kind of balancing a lot of the kind of physical concerns, but also the emotional and like the mental health aspect is so important. So I like that there was a lot of intention behind addressing those kind of upfront as well. Yeah, and Emily, wanted to ask you, it's interesting because I'm curious to kind of get your thoughts from a Europe lens. But I think that there, is a lot of these more macro level issues, challenges, just things that we're kind of seeing as it relates to pregnancy. Are there, just from your own research and the experience that you have, are there any specific trends, conditions, concerns that you are anticipating that will kind of continue to become more impactful in the future? And also very curious to kind of get your lens, kind of supporting the European market.
Yeah, definitely. I think there's several different macro kind of topics. I can touch on a few for sure. And obviously, these can be influenced by different demographics. Advancement in technology, I think, is really going to be interesting, and kind of shifted
Mm,
healthcare policies are going to have an impact on all these things. But because of maternal age increasing, as we mentioned, and the higher risks of pregnancy, I think when you look at global health disparities, so access to quality healthcare, that's something that is an issue. You might have access to some sort of healthcare, but having the right quality is a completely different thing. So digital health tools, I think, are going to see those increasing, right, with use of
mm,
telehealth or AI remote monitoring devices for pregnancy. So women can also help monitor themselves either at home or with a healthcare professional. Getting more access to services from governments. I really hope that is something that is prioritized across the globe. So in every country, that really should be something that is high on the agenda. I think healthcare, kind of health system resilience in that way. So building systems that are actually capable of adapting to these changes and
mm.
changing circumstances, for improving maternal health outcomes are going to be interesting. Mentioned mental health, but this is something that's so important. So many women and families, new families are struggling with mental health, during pregnancy, but also postpartum. And we can't forget about that postpartum period. And then the kind of another one would be lactation support. So we see a lot of mums struggling to breastfeed. So they want to breastfeed, but actually they struggle to do so. I mean, the UK is one of the lowest rates in the world. So I think it's less than 2%
Oh,
expected
wow.
to breastfeed after 6 weeks. Where there's a high percentage that want to. Obviously, not everybody is able to, but it's understanding getting that support from a lactation consultant or through an app or through information to really support mums through that. And then we also see we're partnering with companies for reimbursement of breast pumps. So that can also really help kind of ease the cost of providing those products. And that also enables other people in the family to feed the baby, which also helps kind of alleviate some of that kind of stress and helps with mental health and support as well.
Definitely. And I liked how you mentioned, I think there's so many interesting kind of opportunities here that you've outlined. But I'm particularly very curious about some of the digital health things that you were talking about. For you, where do you see digital health, really playing a role when we think about providing the right level of care and support at the right time in pregnancy? Is there anything that you're particularly seeing or that Philips is doing in the broader digital health space? Very curious.
Yeah, so we're definitely we have some partnerships already that we're working with insurance companies. So there's a Swiss insurer, Group Mutual, that we're partnering with a digital health solution. So we're providing Pregnancy Plus to their members, which is fantastic. And it's all about signposting services. So, they might have a loads of resources that are just underutilized or people aren't aware of them or can't find them, which is often the case, right? So you might have all of it on a website, but how do people actually find that information? Is it easy for them to access or is it at the right moment of their pregnancy? So we can really, put the content, the information, we can signpost it, or it could be they have telehealth services that we can integrate, we can make other services available. So yeah, it's about kind of having that in there or a resource directory, things like that, with key information that people just really need but can't find. And that's what we see through our surveys as well, that a lot of people are just like totally unaware of what even benefits they get included either from their employer or through their insurance. So just making that really clear for people, I think, can provide, great benefits. And I think, remote monitoring is another one which I think is really interesting, and how that develops and how that can really help, particularly in underserved communities. When we talk about improving continuity of care, that's something that would be really great. And I think it's about extending the content beyond pregnancy into the fourth trimester, right, into that last 3 months as well. So making it obviously as soon as you give birth, it's a lot about the baby as it should be, but not forgetting the mum and also what they're going through, particularly in the first few months.
Oh, I love that. And you bring up a good point about just, there's so much information, but it's all just so scattered and so fragmented. And I would imagine, I think we all have had experiences with like the black box that is just the internet in general. And so for you and the work that you're doing, I would imagine with the Pregnancy Plus app, but just in general, how are you kind of addressing some of the challenges when it comes to providing, just really trustworthy and expert information when it comes to women's health? I would imagine that, I'm curious if that's something that you've kind of spent a lot of time thinking through as you've been developing a lot of this. these programs that are very content driven.
Yeah, and it's so important that every article that's on the app, right, we have a fantastic content team who really vet all the experts to make sure that, and we also have that information. If you tap an article, you can see who's written it, where their credentials are from, who they where they've kind of studied or where they've got qualifications from. So it really helps people, know it's not just the information that just appeared, right? It's all the references
Totally.
to that, which I think is really important. We have a whole section on tools and resources to support as well. So like the planning, the scheduling, like all of those types of content as well, which is, a really nice thing to experience. And you can also connect the app with a partner or family or friend, so they can also go through the experience with you. So it can be a shared. Yeah, which also is really nice if people don't feel kind of isolated or alone going through this, or if they have, different things that they want to discuss, it's also easier to do so.
And that's good too, because that way everyone is kind of getting the same source of information, which is kind of an expertly vetted source. So I think that's like the added benefit.
Yeah, definitely. And I think that's the benefit as well about having it digitally, because, books are great, but they can get outdated quite quickly. So obviously having, 6 weekly production cycles where the information is constantly being updated. And we see 40% of the mums on our apps are actually second time mums, third or fourth, so they've already had a child. So it just shows you that information is changing so quickly that actually it's still relevant, even if it's been a year or, months in between children, to still make sure that all the information is up to date. So that's a way that's really easy as well. Just the search bar, right? You can find anything that you're looking for rather than trying to flip through a book and find which page did you turn down and how do you find it. I think it's a lot more efficient.
100%. Yeah, that is actually a very good point around, a lot of this information. There's always new interesting stats or interventions, things that are kind of always coming to light. So emphasizing that this is like the most up to date, that this is the most like, well researched, and this is the stance, I think has been so, I would imagine being so helpful during this time. And Emily, wanted to kind of quickly pivot and ask you a little bit more about, you'd mentioned this earlier in the conversation around the work that you do with payers. Really kind of curious to understand a little bit more about, what does that collaboration look like with payers, insurance companies, other stakeholders at Philips to kind of work together and ensure these premium services. Maybe for anyone who's listening right now that's kind of in the payer space or is right now kind of working or looking to partner with payers, would love any insight that you have around that.
Yeah, for sure. So yeah, we have a couple of programs in Europe, and then we work with the US government Medicaid in Michigan as well on programs. So I'm involved in the European side, but the team do great work in America as well. So they're very different healthcare systems. We don't have enough time to cover it all, but it depends in Europe which country you're talking about, if it's public, if it's private. But the goals are very different, right? So ultimately, a lot of the programs we're looking to improve maternal health outcomes, whether that's signposting services, getting people to go to the midwife visits, or to complete certain actions and tasks. So we can really do that through the app. So we can signpost different things, different tasks for them to complete and to do. In Europe, it's very much around providing the best experience for the members. So they're members that are already pregnant, giving them access to this content. So that will therefore they'll have a happy, healthier pregnancy. They'll feel more confident about their pregnancy. They'll feel more engaged as well, also with the provider. So the provider that wins, therefore, and hopefully an improved NPS, the retention, loyalty. But ultimately, it's about the member having the kind of the best pregnancy experience, and therefore not, maybe reduce complications later on, or maybe they'll have, better mental health, or there could be other elements that, because you've helped support them through this time, which is quite challenging, we see benefits later on.
Wow, that's incredible. And you'd mentioned, the work that you do and how some of the regions that kind of fall within your purview are different. Is that kind of just in terms of the way the health system is structured, or are there any like cultural differences as well when it comes to pregnancy care or women's health in general?
Yeah, I mean, definitely loads of, cultural differences. I think, we are across many different countries, so we always tailor to local language, to specific cultural differences. Obviously, healthcare systems are completely different as well, so we want to make sure we provide the right information. So every country is localized in that way, and I think that's I can't remember how many languages we have. I think it's 22 different languages on the app. It's available in most countries. So it's about making sure that the information is really specific to anybody who is in that environment. And that's why we work insurance companies as well to make sure that we put in their content into the app as well, so that it's even more relevant for their members. So we can create customized journeys just for them.
I love that. And I like that you kind of called out some of, making sure that you were infusing some of the cultural components too, because I think that is also so important when it comes to developing just content. So I think that's really great that that was, a very intentional move. I realized, Emily, that we're about like 2 minutes out, which is crazy, but I wanted to just, I know time flies.
Too much to talk about. We could have done an hour, couldn't we?
Seriously. We'll have to have you on for like a part 2 where we just go through so many more topics that you're working on. But I kind of wanted to ask you, just kind of reflecting on your career so far and kind of the progression that you've had, for you, especially kind of the work that you're doing globally, are there any kind of like words of wisdom, any challenges, opportunities, things that have kind of arisen as you've taken on this role that is very global? Anything that, any words of wisdom to share with us?
Yeah, I think partnerships are really important, and that's something that you can't do everything yourself, and you need partners in that space. And that can be, startup scale ups that we work with in different capacities, and it could be, different partners. The CDC or March Dimes or Tommy's Midwife Charity, the NHS. So the partners, are very varied in that way, and they can also support other countries even if they're not based in that country. I think we have challenges, of course, in regulatory environments, cultural differences, different business practices that we've mentioned. So all of those are really important to make sure, but it can hinder progress. It can be a bit slower than we want it to be, but of course those are just some challenges I think a lot of big companies face. You want to be agile, you want to make sure you're developing things as quickly as possible. But yeah, I think opportunities to partner with new companies, particularly in the innovation space, is really we're open to do that, which is great.
That's amazing. And it's cool that it seems like there's just a wide variety of the work that you have, from the payers to the startups to, it seems like, community programs too. So it's cool that it's kind of a very diverse set of, just, I would imagine, really important partnerships to kind of get a lot of these initiatives moving. That is so cool. And then one last question, which is my favorite question, Emily, as we kind of close out our discussion. For you, do you have any just words of wisdom from your career that you want to share with us? Anything maybe that a mentor had said to you that you want to bring forth, or just any kind of professional nugget of wisdom that we can take with us?
Yeah, I mean, for me, it's like all around the networking and the people that you meet. And if that's on forums, LinkedIn, commenting on posts, like, it's funny, I've met people, we've kind of met on LinkedIn, if you like, and now, I'm really talking, creating business opportunities or partnerships, or I've ended up meeting them at events. So I, piece of advice for me was always ask somebody to introduce you to one other person. So, and then you keep meeting people, particularly, there's some amazing networks and forums and that I've been part of in the last year. And I think that really helps grow. And the more people you speak to and you meet, you get great opportunities. So yeah, don't underestimate the power of networking. I think a lot of people say it, but especially if it's not in your comfort zone, push yourself to do it. To make those connections, to reach out, and you just don't know what's going to happen or what's going to come from that. So yeah, that would probably be the one thing I would say.
No, that's such a good one. And that's actually a very good reminder for me too. I like your idea of kind of can you introduce me to one person? And I would imagine that just spreads out like crazy the more people that you ask. So that's a good tip for us. Awesome. Thank you so much, Emily, for such an enlightening conversation. We definitely need to have you back for a part 2 at some point, because this has been so engaging and fun. So thank you all for kind of participating.